Hello and welcome to episode 119 of the Low Back Pain Podcast. I'm your host, Dr. Grant Elliott with RehabFix online low back program. And today's topic is how to avoid wear and tear of the spine. This is something so many people are told, oh, your pain's just because of wear and tear. You have degeneration, you have disc degeneration. This is why you feel pain. And that is just so much BS. It is total bogus. It is total crap. And I'm going to explain exactly why today. If you have not joined my private Facebook group yet, you need to do so. It is called RehabFix Low Back Program. And immediately upon joining, you will receive our free step-by-step sciatica guide, one that we have used to help thousands of people across the world recover fully from sciatica. This is literally the same step-by-step process that we take them through during our assessment calls. You can get a clear idea of kind of what's going to help you and what that plan might look like. It is worth thousands, and you will get this for free just by joining the page. And there are other free courses and trainings that I have in there as well. There's tons of information in there. So if you have tons of highly valuable and free information, and you're actually serious about getting better, then you will join my private Facebook group, RehabFix Low Back Program. I'll see you in there. So why is wear and tear and degeneration total crap? How can you avoid this? What is the overall fact about this? I'm going to go into it right now. I'm going to give you a few different stances, okay? First off, can you avoid wear and tear? Yes and no. Can you avoid disc degeneration? Yes and no. The answer is yes and no to both of these. So let me explain. Can we avoid aging? No, we cannot avoid aging. Aging is inevitable. We will get wrinkles on our face. We will get gray hairs. We will get big enlarged ears, right? It's inevitable. Therefore, our skeletal system will age in the same manner. Our vertebra, our discs, our joints, all of these things will age accordingly as well. So disc degeneration or a degenerative spine is a total bogus diagnosis because degeneration is normal. It is called aging. It is gray hairs of your spine. It would be very strange if you were 60 years old on the outside, but 20 years old on the inside. That would be very weird. A 6-year-old should look like they have a 6-year-old spine. It makes sense. Okay, now, here's the point I'm going to make now. Okay, that is total BS. Okay, wear and tear and degeneration is total BS. However, on the other side, it's not. Because just like we all age, whether we like it or not, we all age. Can you technically slow down the progression of your age? Not your chronological age, but your physical age. You can. If you look at an individual who is 70 years old, who spent their entire life eating well and exercising, and you compare that to their neighbor 70-year-old who has not been exercising, who has been eating terribly their entire life, who is overweight, who has chronic disease, uncontrolled diabetes, hypertension, they're going to look and move like two completely different human beings. We see it all the time. We see individuals in their 80s still lifting super heavy, so mobile, doing so much, you would think they were in their early 60s. We see this all the time. All the time. So, can we stop aging? No. Common wear and tear is common and normal. Degeneration is normal. Degenerative discs is normal. It would be weird if that did not happen. It is totally normal. It is gray hairs of the spine. However, can you slow that process down or reduce it to the best of your ability by generally being healthy? The answer is yes. Just like you can in your physical capabilities, right? So, on one side, degeneration and wear and tear is totally normal. It's not the reason for your pain, okay? Your pain is not because you have degenerative disc disease. That's total crap. It's not because, it's just wear and tear. It's just the way you're going to be now. That's total crap. Okay, it's totally normal. But can you slow these things down? Yes, you can. How? How can we slow these things down? Specifically for the spine, okay? We're talking about the spine today, of course. That's what this entire podcast is about. That's why you're listening to this. Everything we do is about the spine. So how can we avoid wear and tear? How can we slow that down? How can we reduce that? How can we reduce our chances of any sort of early onset degeneration or things like that? There's a few key things here. Okay, I'm going to basically summarize dietary influences and physical movement-based influences. From a dietary perspective, anything that pushes us towards a chronic disease state will be bad for your spine. It is well documented. Diabetes, not good relationship with back pain. People who have diabetes immediately more prone to back pain and also more prone to recurrence of flare-ups or recurrence need of surgery. If you have a low back surgery and you're diabetic and you're not controlling it well, you have a higher chance of needing that surgery again. Same with smoking, right? Same with being overweight. So these things that push us towards chronic disease will not be good for our spine, will not be good for spine care. Pretty straightforward, but super simple. So simply eating well, being at a appropriate body weight, okay, being a healthy person, a low inflammatory diet, so not consuming a lot of grains, flours, and sugars, keeping those low, okay? Having good blood work, get blood work from time to time, make sure you have a good lipid profile, everything else is good, okay? No metabolic diseases. You are slowing the rate of wear and tear and degeneration to the best of your possible ability, not only in your spine, but in your entire body, but most definitely in your spine. Quick interruption. If you're listening to this podcast and you're resonating with the things that I'm saying, and you're finally ready to be pain-free, and you don't have a plan, and you're not sure how to get there, and you're just looking for that guidance, then visit the link in the description or the show notes below. You can schedule a free initial call with my team, and we will actually go over your current regimen, go over what you should be doing, what you should not be doing, and how a better plan might potentially show you how to get to that pain-free state that you've been looking for so that you can get this over with and back to living your life. So if you're ready to finally figure this out, then visit the link below, schedule a call with us. Looking forward to helping you. Back to the show. Now, what can we do from a physical movement point of view? If you use your spine, you will maintain its integrity. Use it or lose it, right? Movement is medicine. Rest is rust. Oh, you're getting older. Take it easy. All right, you're going to tell that to me if you want me to die young. That's what it is, okay? Getting older, take it easy? No. It is well documented that as we age, we need to have more emphasis on movement, more emphasis on exercise. That is when it is becoming the most crucial in our lives. That is when we should be paying attention to it the most. To maintain independence, to maintain quality of living, and to extend our life as much as possible. So we need to use our spine. We need to put weight on our spine. We need to squat. We need to deadlift. We need to put weight on our discs. It is well documented once again that weight on discs improve their hydration capacity. People who run, who have impact on their spine, their discs are larger and healthier. People who weightlift, discs are larger and healthier. Same thing applies to bone density, right? Number one, cure for osteoporosis is loading the bone. And of course, having adequate calcium and vitamin D levels, yes, but loading the bone. Your bones are weak, put pressure on your bones. Your muscles are weak, put pressure on your muscles. Your discs are weak, put pressure on your discs. Your vertebra and your spine are weak, put pressure on your vertebra. This is super simple. Load your spine and you will keep it strong. Now, additionally, move your spine. We want it to be strong, we want to load it, but now we want to maintain as much articular integrity as possible. Articular meaning the joints, the mobility of it. Articular integrity. You want to maintain optimal spine mobility the best you possibly can throughout your entire life. If you don't know how to move your spine, then your chances of pain go up. Your chances of wear and tear go up. Your chances of degeneration go up. You need to maximally focus on your mobility and your ability to control your spine in motion. Why is this? Once again, movement is medicine, rest is rest. If that joint, if the joint capsules, if the disc, if they're not being utilized and moved through all the range of motion that they are capable of moving through, then the areas that they're not capable of moving through will essentially become rusty. they'll get some cobwebs. Okay, imagine you're driving in your car. A storm is coming around. It's raining on your windshield. But now let's just pretend for a second that rain is honey. Okay, let's pretend that it's honey. And you're using windshield wipers. And as we all know, those upper corners and that kind of middle piece of your windshield will never get totally clean. Okay, so those areas, let's say it's honey. It stops raining honey. Those corners of your windshield still have honey. And it's sitting there. Okay, where the windshield wipers went are nice and clean, but those corners that it missed, they got some caked on honey there. So a few days go by, that becomes very hardened. It rains again. Another layer packs on there. The windshield wipers are moving through the areas that they normally go, but those corners, they get another layer. And then this continues. Those areas of that windshield are not getting any love. They're not getting any love. And they're becoming more and more deteriorated and packed with gunk over time. The exact same thing applies to your joint capsule. If you are not exposing any particular joint, especially your spine, to its fullest range of motion, those areas that it is not being stimulated will become rusty, cobwebby, and a little bit gunky. That is fact. And so the more you stimulate these areas, the more joint fluid is produced, the more hydrated the joint becomes, the more aware your brain becomes of that joint in space, which improves control, which reduces pain sensitivity. It reduces nervous system sensitivity. So it reduces your pain. It reduces potential for pain. It improves joint hydration, joint health. It puts more nutrients into those areas that were being missed, but because you're hitting them are no longer. It is crucial. So you want to maintain optimum movement through all ranges of motion, throughout all of your spine. So when it comes to your low back, what this entire podcast is about, you want to be able to optimally flex, extend, laterally flex, side to side, and rotate. Those are the three primary planes of motion: forward, back, side to side, and rotate each way. Establish consistent movements in your routine that work on these three main planes. Keep them in your routine for life, and you are going to improve the longevity of your spine immensely. And there's multiple different ways you can improve this mobility. You can do it passively. You can do it actively. You can take them through various mobility techniques. There's one method out there called FRC, functional range conditioning. This is one that is great for joint health. Fantastic. Okay. Pair that with just general exercise, good nutrition, good lifestyle. You're setting yourself up for success. You're avoiding wear and tear as much as you possibly can. You are avoiding degeneration as much as you possibly can. Your spine is going to look great and feel great. On that point, even if you were to get an MRI, let's say you're in your 70s, let's say you're in your 80s, your MRI is going to say a whole bunch of nonsense, okay? It's going to say a whole bunch of stuff. It better. It'd be weird if it didn't. But if you feel great because you've been taking care of your spine for years and years and years, and you're not like everybody else at that age who can barely move, it doesn't matter what the image says. It doesn't matter what the x-ray says. It doesn't matter what the MRI says. If you've been consistently maintaining spine health, you're going to be feeling amazing regardless of what the MRI says. So you can do this. You can start now. You can start improving your spine health, not only in your current state. If you do have pain, we can get you out of pain first, but then having a plan to maintain for the rest of your life, to maintain the highest level of quality living, to maintain independence, to have the ability to truly live and not live modified, not thinking about all the different movements you're making throughout the day, not thinking about, oh, I can't do this, I shouldn't have bent over to pick that up, oh, I can't go out with friends this weekend because I can't sit for dinner, I can't do these simple daily tasks. Okay? Let's get you away from that life. We can remove that life from you right now, and we can set you up for success for the next 10, 20, 30, 40, 50 years, depending on your age, of course. We can set you up for success for the rest of your life because low back pain is the number one disability in the world. And if you get a proper plan right now to fix it, and you have a plan that you can carry with you for the rest of your life, you will be bulletproof. And that investment, that outcome is worth infinite more than what gaining that education and gaining that help will actually cost you. Okay? Of course, people who are, window shopping for low back help, of course, they're going to ask us, hey, what does your program cost? I usually reply, yeah, our program costs about 20% of the value that you will get immediately from it. That shows you what I say. costs about 20% of the value that you will get from it. Now, if you multiply that value by the next 10, 20, 30, 40, 50 years that you get to maintain it, there's your equation. It's worth more than anything. Okay? And this is what we help people do every single day. So you can do this. You can avoid wear and tear to the best of your ability. You can avoid disc degeneration at the best of your ability by maintaining these practices, by making a commitment to yourself, by investing the time, investing the money in the coaching, in the guidance, in the education, so that you can make a difference in your life right now that will last the rest of your life, so that you can finally live pain-free and get this thing over with and put it behind you, because you deserve it. Your family deserves it. Your friend deserves it. And we can make this life a reality for you. All you have to do is take action. Visit the link below, schedule a call with us, and we will meet with you immediately so we can start to show you what this plan will look like so that you can get back to living a life pain-free. Once again, be sure to join my Facebook group, RehabFix Low Back Program, so you can get additional exclusive content and our free sciatica guide immediately upon joining. And you can look at the additional upcoming content that we're created just for individuals in that page. It is a great way for you to join a community of serious, intentional individuals, and you can get to see some of our clients winning as well, so you can get a real idea of what is possible for you. If you are watching this on YouTube, please like, comment, and subscribe. If you are listening on your favorite podcast platform, please leave a 5-star rating and review so we can grow this podcast and help reach more individuals who deserve to get results, who feel like they're spinning their tires and getting frustrated in doing so. As always, move more, move in nature, move in the sun. Thank you so much for listening, and have a great day.